for free.
Zachariah Jackson, BASA News. Again, I'm here in Maplewood, New Jersey, talking with Bill Powell. Bill, what is it that you guys actually do at this center?
Okay, well, we're licensed mental health practitioners, and we do psychotherapy, psychotherapy, meaning therapy for the mind.
Okay.
All right, and we give aid to the mind.
Okay.
So we help people deal with things that are interfering in their personal lives, their relationship lives, things that are going on in their environment that they need to understand and
Sure.
make adjustments and change. So we do counseling with children. Myself, I see children as young as 4 years old.
Wow.
Yeah, and up until 80 and 90. Gerontology from infants, or not infants, but 4 years old to gerontology age.
Now, the name of your clinic is the Powell Group?
Well, I started the practice a long time ago, 39 years ago.
Oh, wow.
So euphemistically is known as the Powell Group, but all the therapists here are independent practitioners. They have their own clients, they have their own offices, their own phone numbers, etc. So we're all independent, licensed mental health clinicians, which include social workers, licensed professional counselors, LCADC, which are licensed clinical alcohol and drug counselors, and we have a couple psychiatrists here who are independent practitioners. They're not part of the group, but they rent office space here.
Wow. Wow. And so, let me ask you this, Bill. What was it 39 years ago that made you decide to put a facility together like this?
Oh, well, that's an excellent question. 39 years ago, I was just 31 years old, fresh out of grad school, and I was working at the Family Service and Child Guidance Center of the Oranges, Maplewood, and MILLBURN.
Okay.
And also I was working full-time at the VA, and so Family Service and Child Guidance was my part-time job.
Oh, wow.
And after office hours, the white clinicians would go to their private practice.
Oh, okay.
And I said, well, if they can have a private practice, then I can have a private practice also. So that got me started looking or considering private practice. But back in 1980, when I started my practice, black folk were not going to counseling.
Exactly.
And
Yeah.
so my thing was that I wanted to start my practice, but I was pretty smart. I knew that most therapists don't like to work hard.
Sure.
We like to take the easy cases and etc. So I began to market myself as a therapist that will deal with very difficult cases like children with ADHD,
Okay.
attention deficit hyperactivity disorders, conduct disorders, domestic violence,
Sure.
impulse control disorders, things that other people did not feel comfortable with.
Right.
And so that made me start my practice.
Let me ask you, 1980 versus 2019, have your clients grown?
Oh, tremendously in that time. More and more African Americans are coming into therapy. Many jobs have employee assistance programs that refer people who have problems in their home life and their marital life that affects their ability to work, and
Sure.
they refer them to the EAP, employee assistance, and
Sure.
then employee assistance refer them to us. So more and more, and then just the whole thing about the domestic violence, drug, alcohol, you know, the difficulties that people have functioning. It's a much more of awareness now. People are more sophisticated now. Black people are more sophisticated,
Well,
so they utilize services more.
In 1980, and I guess this comes from an old background of our history, that we normally go to church when we have problems
Absolutely.
and pray them out.
Absolutely.
Right.
Okay. Right. I agree. Now,
You know what I'm talking about, right?
absolutely.
Okay.
But what I've just decided and what I found out over the years,
Sure.
that psychotherapy, understanding yourself, can enhance your relationship with Christ. It can make you a more spiritual person.
Sure.
When you understand yourself.
Right.
So I use, spirituality, religion,
Sure.
God as an integral part of my counseling. And I tell people, the more you understand yourself, the better you can live and the better life you can have. And more importantly, the closer you can be to God. So the closer you are to God, my thing is that, you can function better. And you have to have that faith and that belief that is so important. But the church and all that is fine, but you have to augment it with the whole concept of psychotherapy, counseling, dealing with that hurt, that pain,
Sure.
that trauma, and everything that goes on in a young child's life.
Or an adult.
Or an adult, but everything starts with the child.
Right.
And then ever that is, then the problems that resolve in childhood come problems in adulthood.
What do you say to somebody that still believes that black folk and therapy, psychotherapy is not really for us? You hear it every now and then on shows and stuff like that.
Yeah,
So
well,
when you have a problem, go to church. You talk to God. You talk to your
no. I encourage people to do that.
Okay.
I encourage them to do that. But at the same time, I also tell them that they need to be a part of this whole thing of psychotherapy, which can make them, as I said, they have a better life, and their relationship to God and their closeness to God can be increased.
Okay.
So I do not dismiss prayer, the altar call,
Sure.
The Sunday morning, the
Sure.
preaching. That is very integral to part of our black experience.
Sure.
So you can never negate that. Never. It is a part of our experience. It's something
Yes.
we must continue
But
to
we
believe
still
in.
need therapy.
We still need therapy. That's the main thing. And that's the problems I have with the preachers. Bad boys, they go up and preach on Sunday morning, hooping and hollering. That's good. But they don't tell the folk, look, y'all got to go see a therapist
Sure,
to
sure.
get some of that deep stuff.
Right.
And I tell some of my clients, I said, look, if I were a pastor, to come into my church, let me see your therapy card. Let me have your therapy card here, because you're going to come in my church and you're going to, do your thing for an hour and a half or 2 hours. Then you're going to go back home and you're going to be in the same predicament.
Right.
So if you work on yourself, you can progress better. And I think it's important for people to understand that therapy is not a panacea. It doesn't all instantly make things right, but it's a process. And
It's a building block.
It's a building block, absolutely, and that's important for people to realize.
Wow. What was one of the toughest cases that you've taken?
Oh, okay. Now you want to hear this?
Yes. I want
All
to hear
right. Now my toughest case.
it. Yes.
All right. My toughest case is when I was 29 years old
Okay.
in the service before I got my MSW and everything.
Okay.
And matter of fact, this particular situation really let me know that God had this special ability and a special talent for me to do.
Okay.
I was 27 years old. I'm not 29, 27. I did counseling in the service. And a young serviceman came to me. He was 19 years old.
Yes.
And he said, and I was a private in the service, so he said, Private Powell, my presenting problem is when I see babies in diapers, I masturbate or want to masturbate. Now,
Babies
here
in
I am, that's right. Here I am, 27 years old, and how I handled that, it was nothing but the good Lord. Now, whether he was trying to get out of the service or not, we're not sure. But at least the psychiatrist said, look, he has to go out of the service because this is a serious disorder. So I have to say that in all my years, that was my most difficult case, and that's before I started my my private practice.
So in a case with that case, were you able to help him?
No, I only saw him a couple times. No, because he had to be released. But it let me know, and after I finished seeing him, I said to my supervisor, I said, Jake, what do I do next? He said, Bill, you saw the man for 2.5 hours. You had to do something right. Give him a card and have him see the psychiatrist, and he was going to be discharged medically. So but the fact that I was able to engage him for 2.5 hours, again, I'd say that was the beginning of the fact that I knew that I was anointed to do, and I had a special ability to do the counseling.
So basically, what you did when you were in the service is kind of like that movie that Denzel Washington did.
What was that title? Antoine Fisher.
Okay,
right.
So maybe someone need to write a book about it.
But no, that's how it really started, knowing that this was something that I would love to do.
Wow.
So that was difficult, and that's before I even had my master's. And I have to say, since I've been in private practice, I've had number of cases. But see, I'm like Will Rogers. I never met a client I never liked. I really don't think that all my years that 99.99% of all my clients, I really love them. I tell all my clients that for me, all my therapy is done with love.
Sure.
I have to love you in order to help you. Now, I'm not perfect by all means, but I, as a therapist, we enter into the hearts and minds and the deepest level of people, and they have to feel very comfortable with us, and we have to do our very best to love them in order to help them.
How long do you work with a person?
Well, it varies on, I would say, I mean, you should say within 6 to 8 sessions if you're doing short-term therapy. There can be some adjustments or some changes depending on the person's motivation, depending on their diagnosis, depending on the things that are going on in their life, and so it depends. But I would say 6 to 8 sessions. If the person is really motivated, they can begin to make some adjustments and some change that will allow them to continue.
And, okay, you've seen that change happen. Have any of your clients ever come back after?
Oh yeah, sure. All the time. I've had people 10, 15 years, that knew me, and they come back every now and stop in and say how you doing, and I appreciate what you did for me, and etc. Yeah.
Well, I guess the next question I want to ask, I guess I kind of asked earlier, but I'm going to phrase it different. Why in our community that we don't seek therapy? It's not a question. It's not it's not,
well, look, come on. Part of it is due to ignorance, and part of it is due to slavery. Okay. I mean, the slave master didn't want us to know that we can help ourselves, because if we help ourselves, we get smart and we overthrow him or her. So it's part of our DNA, is part of who we are, that has not allowed us to and see or utilize the benefit of psychotherapy. But as I said, that is changing, and I said we have this.
As we mature
and we have this big office here. We have it's about 13 or 14 mental health professionals, and we see a large number of people a week. I see a lot of people myself. I work 6 days a week.
Wow.
Yeah.
Wow. Mm-hmm. They come in to meet the different therapists.
Yeah, right. And some people want a male therapist. Men sometimes, most times, want to see a male, And if there's marital counseling, most men want to see a man, and women sometimes want to see a female. Mm-hmm.
Well, Bill, with all the work that's been done, you've seen the change in the people and the change in the community. You've been a helpmate to the community. How are you received by let's say, the reverends and the healers in our community? How's Bill taken?
I'm being facetious here, and I probably shouldn't say this. I want to stay away from the healers.
Okay.
I want to stay away from the pastors. Now, I hope if a pastor is seeing this, I'm just saying that they do not realize the benefit of counseling. And if they realize it, they do not refer their parishioners to counseling. You know, most of the pastors are not trained mental health practitioners, and they don't understand that this is a conduit, that this makes their parishioners' life easier, and that they can handle their issues and problems better if they seek out counseling. Counseling is medicinal, is good medicine.
Well, I guess we kind of think that the Bible and prayer.
And I want to be very, very clear that the Bible and prayer is significant and is important. Got to remember that.
Yes.
And that's the basis of who we are as black people. And so once we ground it and that's our foundation, then we come up to another level and we build it up with the psychotherapy, with the mental health counseling. And so many people have been hurt and
deep tissue scars.
Right. And another thing I tell my clients all the time is that all behavior comes from two places and two places only: nature and nurture. Nature from the biochemical, neurological, genetic makeup of the individual and generations of the individual. Sure. We hear them pastors talk about those intergenerational curses.
Yes.
Yeah, well, we're all part of that. We're all part of that. That's all nature. And then it's the nurture, is the conditioning, is the environment that we're in, what we see, what we hear, what we feel. That's who we are. So sure. All that kind of stuff is part of who we are. And when we go to the altar, all that stuff is still there. Sure. And just putting it all on the altar is important, but it's not the main. It's not the main ingredient.
Sure.
The main ingredient is the releasing and the counseling and talking about things, getting in touch with so many things that we're afraid to talk about, we're embarrassed to talk about. Sure. We know so many people, and now sexual molestation.
Sure.
Oh man, that's a real biggie. Men, women, boys, you name it, and people are afraid to talk about that. Usually, when I come in for an intake, male or female, before they leave out of my office, have you ever been sexually molested? Have you been raped? Have you been verbally abused? All that. And they feel comfortable talking about it. I tell them this is a safe place to be. There's nobody in the room but the good Lord, them, and me.
Right,
and we can work it out together.
Have you been able to help people that come through in the sexual thing? Because that's such a deep, and that's what I hear a whole lot these days.
Yeah, right. Yes, we're able to help them, right? Because heretofore they haven't talked about it. They haven't released and let go, and they don't understand that they're part of a situation that's been very painful.
Let me interject this.
Sure.
Bill. I want to say this here.
Sure.
How is it okay? A person, let's say, have been sexually molested, and then that person, because they have never spoke about it, is still in their life.
Yes.
So how do they deal? After you help them, how do they deal with the person that's still in their life that they have said, it didn't happen, or God forgave you, or whatever the case may be, but now you're bringing it out. How do they go back and deal with that person then?
Well, see, sometimes what has to happen is that we have to, if you're talking about a mate, you're talking about?
Well, okay, in terms of, let's just take a woman, maybe a relative or maybe a friend of the family, or, you know, has sexually molested her when she was young or whatever, and that person is still seated in their life.
Oh, now that's a
You
real,
know,
I'm sorry, that's a real difficult one there.
Yeah.
Because you know the perpetrator is, you're saying the perpetrator is
It's
still
still
around.
in their life because they went and prayed about it and forgave about it, but it's still in them.
Right.
And then after they realize that they need this psychotherapy, and then, you know, and you guys talk to them,
Yes.
but
Right.
the person is still there somewhere in their life, somewhere in their family, whatever. How?
Okay. Well, in most instances, in my experience, the perpetrator is not there.
Okay.
In most instances, the perpetrator is not there. Now, sometimes it is, and that makes things more difficult for the individual.
For the individual healing?
Yes, for the individual healed. But the
Okay.
most important thing is that they are survivors. That these people are survivors.
Sure.
They still are able to go to work every day.
Sure.
They're able to raise their children.
Sure.
Now they have issues in relationships now.
Sure.
They really do. But there's still a level of functioning in the people that have experienced sexual abuse and molestation. But generally you'll find they will be depressed.
Sure.
They will have difficulty in relationships. They will have multiple relationships. Sometimes it's drug and alcohol
Sure.
abuse and etc. But in my practice, a large amount of them are still able to function. They're able to work, and they're able to raise their children. They're able to to think, and they're sometimes bad judgment, but they're still alive.
Sure.
And they're functioning. And I think we have to understand that probably has a lot also to do with our black experience,
Sure.
with our church experience.
Sure.
All right, with that,
We're
which
overlooking
is
things.
yeah,
and-
right.
and right.
Yeah, very important.
Yeah.
So that you know, that is very important.
Yeah. Have you had anybody after healing to say that they're gonna go and do some revenge?
Generally speaking, no. No. Matter of fact, I have to help them understand that people are human. Everybody experiences some trauma in their lives. And
Sure.
people who even do wrong things, they've done wrong things because of nature and nurture.
Right.
You know, so sometimes it's in the genes.
Sure.
Other times it's environmentally.
Sure.
Sometimes it's a combination of both environment and genes. But, you know, as we move forward in life, we have to, those of us who are Christians, we have to even forgive people who do bad things to us.
Sure.
You know, and that's very, very difficult
Very difficult.
for people to do. But it is possible.
In the conclusion of this interview, I think we covered so much in such short time. We're 19 years into the 21st century.
Yeah.
January 1st of next year, just a month or so away,
Yes, sir.
will be 2020.
Yes, sir.
What, if I ask you, or I'm going to ask you, what should be our healing journey, and as we mature in the 21st century, as we go into 2020,
Okay.
the numbers change.
Well, that's a good question. I'm 77 now, and I've been thinking about that. And the older I become, I realize that as we go through life,
Sure.
God is with all of us.
Sure.
And I understand that the people who, in my opinion, the people who are closer to God, the people who truly know how to use God's healing powers and scripture, not only scripture, but know how to behave.
Sure.
You know, and understand who God is. You know, those are the people who are going to really, you know, survive. and part of, and you can do that
Sure.
by psychotherapy, by counseling, you know. And so my thing is, I tell all young people, if you want to get into a profession where you can make a decent living and you can help people heal, get into social work and psychology and psychiatry, because the world is getting, it's not getting better, it's getting worse. So only the strong shall survive.
Sure.
So the people who understand themselves, the people who go for help, people who understand their relationship to God, with the things they need to do in order to be closer to God. You have to understand yourself. And as we speak, I have 5 spiritual principles, my good friend, I want to leave you with before we leave. And it's so important, and I give this to all my clients. Principle number 1, God helps those who help themselves.
Amen on that.
If you do nothing, you get nothing.
That's right.
If you run in place, you go nowhere.
That's right.
If you walk in place, you go nowhere.
That's right.
But the more you help yourself, the more God helps you. Principle number 1.
Okay.
All right. Principle number 2. God works in mysterious ways, his wonders to perform.
That's right.
God can enter the heart, the mind, the spirit, the soul, the body of anybody, anytime and anywhere.
That's right.
All right. Number 3, you take 1 step, he will take 2. All right. So wherever you're going, you get there faster and you're going to heal quicker.
Okay.
All right. Number 4, the power of life and death is in the tongue, the spoken word. Whatever man or woman speaketh, so it is.
That's right.
And we have to learn how to be positive.
Yes.
Have to learn that our words have meaning.
Yes.
And they dictate what we do.
That's right.
And then number 5, we walk by faith, not by sight.
Amen.
Wherever we're going, we have to have faith. And that faith is connected to the Creator.
Yes.
And we have to understand that. My thing, my God, be not afraid.
That's right.
All my folk coming here talking about how much they love the Lord. No. If you love the Lord, then there's certain things you have to do. You cannot walk in fear. And then you have to get into all that stuff that made you fearful in the first place.
That's right.
All the stuff you heard from your ancestors. All that stuff
all that
you
muddy
heard.
water.
All that, right. All that stuff you heard. You became conditioned to the past.
Sure.
Rather than understanding the brightness of the future. And that's what
Bill, tell the people how can they reach you?
Okay, they can reach me by calling 973-763-8123. I usually have a 6-day week, and I'm here, 7-8 hours a day, and I'm here on Saturdays also. And we're at 2130 MILLBURN Avenue, Maplewood, New Jersey, and we have, as I said, 12 or 13 African American mental health professionals that can help you on your journey, through life.
Okay. Again, Bill, it's been a pleasure.
Zachariah, it's a pleasure here, man. Appreciate it.
Yes, sir. Zachariah Jackson, BASA News. Good night.